My name is Dr. Larry Bybee. I'm a biological dentist in Pocatello, Idaho. Biological dentistry just means to treat people like they're people and not mechanical beings. I've been doing dentistry for 42 years. Biological dentistry for about 20 years. So, and actually really treating patients biologically for the last 8 years. So I did treat children only for 19 years. So I've had a wide scope, wide practice range of treatment modalities. So there's a difference between biological dentistry and holistic dentistry. Holistic dentistry got its name going years ago, but they tried to treat all aspects of dentistry with herbs and muscle testing and those types of products rather than getting into the point of being able to do surgeries. So biological dentistry takes a lot more skill, and we only use non-metal, no mercury, no fluoride, no poisons. So that's kind of biological dentistry, at least in a quick way to look at it. If you look in somebody's mouth as a dentist, if you look in and you see dental decay, you know that there's something wrong with the body, because the mouth is just a window into what's going on. It's the same tube, so to speak, from the mouth all the way from the north end to the south end. And we have the same bacteria, we have the same problem. So if the gut's not working properly, you can see it in the mouth and you know that there's a problem. So if there's decay, then we know that the body pH is off. It's not so much about the germ, it's about the terrain or the milieu. What is going on the inside that's causing you to visibly see decay in the mouth, or receding gums, or bleeding gums. That's an inside out, not an outside in. And in dentistry, we always want to chase the germ. Medicine wants to chase the germ. And you're never going to solve the problem, because it's not the germ, it's the environment that the germ lives in. If we look back in history, our ancestors, first of all, didn't have dental decay. That was not an issue with them because they ate naturally. You know, they didn't eat very much sometimes, but they ate pretty naturally. And so brushing your teeth in today's world is much more important than I think years ago, because we were challenged by a diet here in the United States and even in the world overall, the Western world anyway, that we don't really eat food. We eat a lot of food-like products, but every time we're eating those, then we're changing that milieu, or what we talked about a little earlier. So when we're not eating food, then we're changing. We're becoming more acidic. And so the body was designed to be alkaline. It gets a little complex, but the more alkaline the body is, the higher capacity that each cell has to carry oxygen. Oxygen is our number-1 nutrient. So daily care along those lines is, we do want to brush, and there are ultimately what we want to end up with is, when we're brushing, when it's done, we want to check the pH of our mouth and say, hey, that's an alkaline environment. I left my mouth in an alkaline environment. And why is that important is because if your pH of the oral environment predominantly is 6.8 or above, then it's chemically impossible to get dental decay. I think the Country Health Clinic, I've been involved with them for, gosh, I don't know, Christine, it's probably 20 years or longer, pretty closely. And it's a great clinic. They help a lot of people. And if you're having anything that's bothering you, have questions, come on over, because you'll be treated very, very well. And you'll be treated like you want to be treated. If you have questions, they'll answer your questions, and they'll be your servant while you're here. So highly recommend them.